I'm Carissa.
And I'm Chris.
And we've been married will be 15 years this upcoming summer. I was 38 and a half weeks pregnant. Everything was perfectly normal. I didn't feel movement one night and went to the doctors and there was no heartbeat. We had about a day between finding that out and then when we delivered her. It was Valentine's Day in 2006.
It's a moment you never forget. I found out that our daughter wasn't alive anymore.
Then things kind of quickly went into motion to prepare for the delivery the next day. Within probably an hour or two of hearing the news at the doctor's office, I was on the phone with Rosie. She and Shirley and the other members of the Still Missed program were great about helping us prepare for that delivery the next day.
We try to meet with the families as quickly as possible. We meet with them then to go and give support, tell them about the program, tell them about their options, how they can parent their baby, and just sort of what the hours and days and, even further down the road is.
Life after the Still Missed program over the last 25 years has been so much better. They took a weight off of our shoulders. That grieving that we experience starts, of course, with the family, but then the caregivers are grieving too. Physicians, nurses, especially if we've gotten to know these patients through days, weeks, months, then it's a big loss for everyone.
Really, within hours of starting to even be on this road, Shirley was starting to talk to us about the support group. We were aware of the fact that there were others who were on a similar path and who did meet and get together. Going to the support group itself every month was so helpful for many reasons, but among them, it was a safe place to talk about Annabelle.
This is what we call our palliative care family room. About 5 families helped us with this room here, which was one big dream that the families had, was that we would have a place for them to come and parent their babies. It's a nice, comfortable place where they can take care of their baby because they're a mom and a dad, and the time that they have to parent their baby is so little.
The team really kind of acted as advocates for us. It just gave us kind of a warm place in the room where we could be with our daughter, and we knew that was going to be a fleeting time.
Encouraging us to hold her and spend time with her, and they really told us, if you have any clothes or anything for the baby, be sure to bring them, and you can dress the baby in them. And we had a quilt that my mother-in-law had made specifically for her.
Without Still Missed, I don't think we would have had that or known to kind of push for that. The idea of a haven in a time of a lot of strife was really important to us. We want people that are going through that now to not feel alone. And Still Missed does a great job of that, and we think it's really important to remind people that they're not alone and that other people have gone through this as well.
There are moments of God in these situations. There's moments, whether it be a look or a touch between a husband and wife when they are holding their baby for the last time. There's a great depth to these experiences that involves not only the loss, but also the hope for the future and the hope for healing, because that's the mission of our hospital, is to extend the healing ministry of Christ.
I think it's almost a taboo topic and subject in today's society. I don't think people are encouraged to talk about death, especially the death of a child, and they helped us slow down and experience it and cherish it.